Today we'll be talking about the effects of social support for athletes with anxiety at return to play. My name is Ben Stahoviak and I'm a certified athletic trainer. I graduated from Aurora University in 2017 with a Bachelor of Science in Athletic Training. I grew interested in this topic mainly to see what affects athletes. How does an injury differ from one athlete to another? And that usually comes with anxiety. Most times athletes will prolong an injury because they are nervous about returning, that they are concerned that they might re-injure, or they are concerned that something will happen again. And my goal today is to educate you on how I can prevent that using social support. So today the outline will be the practice problem, the PICO question, the anxiety and social support, the evidence change model, data-based evaluation, the dissemination, and a conclusion. So the practice problem. The practice problem in this is that in athletic training, things are always holding you back, and your job and your goal is to ensure that these athletes get back to full recovery. And within 40 to 50% of all injuries last usually longer than a day, which means that there is prolonged anxiety happening throughout this time. So within that, social support has been shown to be a high rehabilitation product to help reduce this anxiety, and that's where the issue is, because there hasn't been enough usage of social support in athletic training. It's always we look at the physical aspect and what we could do physically to help this athlete, but never mentally. So that brought me to the question of, in college and elite athletes, what is the effect of social support on decreasing post-injury anxiety compared to those who do not receive social support throughout their recovery? In anxiety, a psychosocial factor is pretty much predisposes them to injury. There's two different types of anxiety. There's trait anxiety and state anxiety. In trait anxiety, it's pretty much a non-modifiable trait. And that's mainly because it's all psychological. It's all up in their head, and it's pretty much too much thinking where you really can't control that. That's their own person, and that's how they react to things. State anxiety is modifiable. That's anxiety that we can help reduce from the outside and do what we can to reduce those anxiety. So when you're looking at anxiety and injuries, the longer the injury, the longer the anxiety. The more severe the injury, the longer the anxiety. Social support doesn't necessarily change the severity itself, but it still changes how much we could reduce that anxiety during a longer period of time. So within social support, it typically consists of two people, a provider and a recipient. So the main goal of that is that provider is trying to look out for the best possible care for the well-being of that recipient. And the reason mainly for this use is to reduce anxiety, to reduce stress during rehabilitation, to reduce that worry and unease of these athletes while they are trying to recover. So within my research, there was a few keywords that I used while trying to locate articles. I used the words anxiety, college athletes, elite athletes, risk of injury, social support, and return to play. Some of the inclusions I used were just college and elite athletes over the age of 18, mainly because if they're under 18, they're usually in high school, that they have received social support, the articles in English, and roughly from the years 2000 to 2019. Some of the exclusions that I used throughout this research is high school athletes, prior chronic illnesses, data with missed data check-ins, meaning a lot of these data collections are self-reporting. So if there's a chance that these athletes were missing self-reports, to me, I didn't believe that data was valuable, and I didn't think it was reliable. And the resources I used to find these articles were the USA database, the EBO SCO, and Google Scholar. So within my Prisma, I roughly found about 9,362 non-duplicated articles. When applying my inclusion and exclusion data, I was able to eliminate 8,700 articles, which left me with about 662. When looking through the full text screen and the data extraction, I was able to narrow down to about 28 articles. I did not use all 28 articles within this research, but I found which one was most valuable to me within the specific research I was trying to find. So within the evidence, there was 7 articles that I felt was the most valuable throughout it. Within this research, there was plenty of information that was given that was beneficial as far as within orthopedic injuries that, they felt there was higher satisfaction than concussed injuries, higher satisfaction in social support, mainly because when you look at orthopedic injuries, there's more hands-on from the athletic trainer. Where concussion, it's more of rest, stay at home, try not to read as much. They don't feel that full connection like an orthopedic injury does. And that's where athletic trainers itself have to try and change that for both. You need to be checking up on the concussed athlete. You need to be talk to them a few times a day. We need to help reduce this anxiety for those, even if it's not an orthopedic injury. Most athletes have used athletic trainers as their primary source of social support, and that's because that they work with them the most. They still use coaches as much, mainly because once they return, they control when they play. They control if they're in or they're out. So that is usually the second runner up when it comes to social support, that they want to have that coach's influence just as much as athletes. And most of them still use their medical staff, the teammates, and their parents, and they feel more cared by, especially family members, because they feel that more love from them, that family love, and that really influences on reducing that anxiety. So the change process. I used the Havelock model from 1973. I felt this model, use the proper steps to really isolate my goals and objectives of trying to produce this change. So within building the relationship, it's really about finding what the change is, stating what's going to work, and that's where my goal was to reduce anxiety. My objective was to do what I can to get these athletes back on the field as quick as possible without re-injuring. So when I was evaluating the need for change, I didn't think there was any awareness of this change. I didn't feel like there was enough, articles specifically on this or enough knowledge from other athletic trainers that this needed to be changed, and that's where I felt it needed to go. So when I was gathering the information, we talked about the Prisma, and I found roughly, I think out of that, I used roughly 12 articles to gather as much evidence as I can. So when I was choosing this, there was plenty of articles using different types of support to help reduce anxiety, like imagery, or speaking with a psychologist. And to me, I felt the most beneficial is social support, because I feel that we have the most resources possible, especially being an athletic trainer. We have the physicians, we have nurses, we have coaches, teammates, parents. We have a giant selection to choose from to help these athletes. And that's where, my plan of, establishing this change was ideal. When I was looking at how, once this change is accepted, like, how can it be monitored? And that's when I was like, well, as I'm teaching other athletic trainers, it's important for them to understand how I'm doing this. And it really comes down to, taking them, monitoring them, and being with them to understand, all right, this is the type of social support we're going to be using. We need to help discuss with them, what's occurring, how this is going to work, and help them feel comfortable throughout this process while documenting it very detailedly. That will help kind of, understand, all right, what benefits are we getting at what certain time of this rehabilitation. And at the return to play, it's the most essential, because this is when they're most nervous. This is when they have high anxiety of maybe re-injuring themselves. And that's where we need to stay on touch of, all right, once I monitor a small group, once they feel comfortable, I could let them be. I could let them continue this practice, and then I could move to a new group of athletic trainers and help get this change moving along just step by step. Upon the data-based evaluation, there was 2 outcome measures that I used throughout this time. It was the state trait anxiety inventory and the 6-item social support questionnaire. So the state trait anxiety inventory consists of a 40-question questionnaire, usually 20 on state anxiety and 20 on trait anxiety. The 6-item social support questionnaire had 2 parts. One was the type of social support they were receiving, and 2 was the resources they were getting their social support from and the satisfaction of that social support. Upon the data analysis, the most efficient analysis was the t-test, and that was mainly because it isolated 2 separate groups: the dependent variable, which would be the athletes, and the independent variable, which would be the social support and what the resources were as far as satisfaction were of the testing. So within the dissemination, I felt the most effective way to present this information was by PowerPoint. I feel that within the PowerPoint, you're able to verbally talk with them while also being able to present the key points of what is occurring. And with that, it has also been shown that PowerPoints have been able to give the best lessons because you are hitting you're hitting visual learning and also verbal learning. So when presenting this research, institutionally wise, I felt that, presenting this information to my department would be very essential to hitting the athletic trainers in this area. There would be approximately 20 people right there that I would be able to cover. Second, I would like to present this to my hospital. I would like to be able to present this to the doctor, the nurses, the psychologists, physical therapists that are working within this hospital, to be able to learn and see what other aspects we can teach in healthcare. Third one within the institutional would be the colleges. I feel that, teaching to those that are coming up into our profession is essential. Every year we have new graduates, and every year we have, younger athletic trainers, and they need to understand what is best practice coming up and what we can do to change what the books are saying. Regionally wise, I would pick the Alabama Athletic Training Association conference. They host one every year, and I feel it would be a good way to be able to hit as many population I can in the state of Alabama to slowly expand this change. And nationally, I would pick the National Athletic Training Association Symposium. That is a very big symposium, almost 100,000 people of, doctors, physical therapists, athletic trainers, even some professional medical staff that present at these present at the symposium. That, if I'm presenting there, that there's a good chance that maybe they'll be stepping in to listen to my presentation. And being able to expand this knowledge to as many people as possible is my main goal. So, practice recommendations. At the end, social support is what we need to do to reduce anxiety. When you're looking at an athlete that is showing high social support, especially in orthopedic injuries, there has been greater satisfaction of that. We need to increase as much social support as possible to reduce the state anxiety specifically. About 80% of athletes, rely on this, and that's why it's essential that we use this. And if it's strictly athletic trainers that are helping this, then we need to influence the coaches, the teammates, and the parents to be involved in this to help get them to 100% reduction of anxiety. And by doing this, it really just comes down to, being there for them. When, I have an athlete right now who has a hamstring strain. And right now, first couple days he couldn't move. I started talking with him every day. All right, this is what's happened. This is your progress, and this is what we need to do to get you better. And I have to literally convince him. All right, let's go through the drills. Let's go through the motions, and keep building his confidence day by day by just letting him know that he feels good, letting him know that he has this confidence and he has this power over, his mind, that he feels good, that he's able to return. So lastly, the conclusion. So it's really important that we start implementing this into our practice. It really needs to be focused on and needs to be used consistently. It's the key focus to reducing anxiety, and we need to use all these possible resources to reduce this. By reducing this anxiety, it really just needs to focus on, talking to them, making them block out their mental blocks, and have them feel confident when you're wrapping them or taping them. Explain to them, hey, don't feel about this wrap. Don't pretend this wrap isn't there. Pretend your ankle's fine. Pretend your injury is 100%. And when you go out there, think that you're 100%. You got a shoulder injury, go hit someone right away. Tell yourself that you feel good. Go run some sprints. Make some cuts. All of a sudden oh, my ankle isn't hurt. We need to be able to convince them and talk to them and let them know that, it isn't just mental, that we need to show them, how the social support is effective. And athletes can't do that on their own. That's why they need us to help this. And their health is our priority, and that's where I feel that we need to really focus on doing the right thing and applying the social support in the right way and being able to help reduce anxiety. Thank you.